to those interested in pursuing a career in medicine. Please make yourself at home in the Indian Anatomists community. Today's lesson is part of an ongoing lecture series. The subject is General Anatomy 1. Before going to topic, what is anatomy? The study of the structure and organization of the human body is known as human anatomy. Human anatomy is a complex discipline that requires understanding the various systems, organs, tissues, and structures that form the human body. As aspiring doctors, we must first familiarize ourselves with the language. In general, language is an important way for people to communicate. Even though every species has its own way of speaking, humans are the only ones who have figured out how to do it through cognitive language. Language gives us the ability to communicate our ideas, emotions, and thoughts to other people. Is there any language for medical fraternity? Universal medical language is a communication system or approach that is intended to be understood and utilized by physicians from diverse linguistic origins and cultures, bridging the gap between native language physicians. Most of the medical language are derived from Latin or Greek, approximate 75%. Now, what is that language? Medical or clinical terminology is the language used by doctors and other medical professionals. Now, what clinical terms will be taught first in a medical program? That is, anatomical terminology. Anatomical terminology refers to the standardized language used by anatomists and medical professionals to describe the structures, regions, and relationships inside the human body. The process of acquiring knowledge in anatomy bears resemblance to the process of acquiring proficiency in a foreign language. Mastering the anatomical alphabet is a must, since it is the global language of medicine. This is the most important thing, and everything else is built on top of it. The following is a list of the anatomical terms that medicos should be familiar with. 1. Anatomical position. 2. Anatomical planes. 3. Anatomical terms in relation to direction. 4. Anatomical movements. And number 5 is anatomical regions. Now, what is the normal anatomical position of human body? The normal anatomical position indicates standing upright or erect body. Head and eyes are facing forwards. Arms hang by the sides of the body with straight elbows. Palms of the hands are facing forward. Feet are closer and parallel together, and the toes are pointing forward. Now coming to anatomical planes of the human body. The anatomical planes are imaginary planes that are utilized for the purpose of describing the position of structures in human anatomy. They are applied to the human body in the location that corresponds to the anatomical structure. This video aims to provide more comprehensive examination of the anatomical planes, focusing specifically on the three often utilized planes. They are sagittal, coronal, and transverse planes. The sagittal or median plane is a vertical plane that runs the full length of the body or structure and splits it into two halves. The mid-sagittal plane is a portion of the sagittal plane that divides the body into right and left halves. It runs through the navel or belly button. What is parasagittal plane? The plane that divides the body into right and left halves, that is, parallel to the sagittal plane, but not in the midline, is called a parasagittal plane. As a result, the body is not equally divided into right and left halves. Now, what is transverse, or horizontal plane? The transverse plane, also called as horizontal plane, which divides the body into upper and lower half. This plane is always perpendicular to the median plane. Now, time to discuss the coronal plane. The coronal plane is likewise a vertical plane, but it is perpendicular to both the sagittal and transverse plane. It divides the body into anterior or front portion or part, and posterior or back portion or part. Apart from normal anatomical position, the person or patient lies on the bed or surgical table in some clinical postures to facilitate normal physiological processes, or to reach certain anatomical areas during surgery. The patient's position depends on age, weight, size, and medical history, notably respiratory or circulatory problems. They are supine, prone, and recumbent positions. What is supine position of human body? It is also called dorsal recumbent position. Supine position is a horizontal lying posture, with the face and front body are facing upwards. Many surgical procedures use the supine position, especially during thorax and abdominal surgeries. Prolonged supine position can cause nerve injury and pressure sores. What is prone position? This position is opposite to supine position. It is a horizontal lying posture with face and front body facing downwards. This posture is used in several spine surgeries. Normally, the prone position improves the oxygenation in respiratory distress patients, coming to recumbent or lateral or side-lying position. This position is further classified into right and left lateral recumbent positions. In right lateral recumbent position, the person or patient lies on right side, allowing access to the left side of the body. The left lateral recumbent position is opposite to right lateral recumbent position, Fowler's, or semi-sitting position. It is also called a semi-bed position. In this position, the person's or patient's body is bent like an alphabet, L, at the junction between abdomen and lower limb. It is due to the backrest of the bed is elevated, at an angle of 45 to 60 degrees. This position can be low, that is, 15 to 30 degrees, or semi-high position, with an angle of 30 to 45 degrees, or high position, that is more than 45 degrees. Now, Trendelenburg's position. In this position, the patient rests supine, with their feet is in higher level than the head. In this position, gravity draws the intra-abdominal organs away from the pelvis, thus improving the surgical access. Hypovolemic shock was treated with the Trendelenburg posture to increase cardiac output, heart circulation, and organ blood flow. Now, what is reverse Trendelenburg's position? This is opposite one, that is, the head level is higher than the feet. Head and neck surgery and gynecological procedures use reverse Trendelenburg position to limit blood flow. Surgical exposure of prostate and minimally invasive upper abdominal operations benefit from the reverse Trendelenburg position. At last, what is lithotomy position? The lithotomy position is commonly used during childbirth and other procedures involving the pelvic region. To perform this, one must lie on their back, and bending the knees to 70 to 90 degrees, and hips to right angle. The legs will be propped up by padded footrests that are attached to the surgical or investigation table. Dear students, in the next video, we'll see about the anatomical terms. Thanks for watching, stay tuned. Please like, share, comment and subscribe.